Hi, Neta. We can see you.
Hi, good evening.
Good evening, and we can hear you as well.
Okay. Do you want to wait for anyone else or do you want us to start?
I think we can start now. They'll go on the way, but that's fine.
Okay. So, good evening. Welcome to ParentGood. I just joined as a specialist and I'm very excited. I see, yeah, people are already online. So, great job. You are welcome to ask me questions. You're welcome to write the questions down and we'll discuss them after my talk. I want to make sure that you get as much as I can answer your questions. My name is Neta Shani. I started off as a pediatric acupuncturist. I never planned on doing anything with sensory issues because I didn't even know there was such a thing. Sorry. Oh, I thought someone asked something. Um, I have a boy-girl twins, and they gave me a lot of challenges when they were a little younger. Things that usually acupuncture and herbs were helpful at, I just wasn't able to help them. And so I started seeking other tools. And when I started addressing their issues, I noticed that some of their weird behaviors started changing. Like my son could not sit in a restaurant. He would say, "Oh no, it smells," and ran out. And I didn't know there was something, I thought it was just him. I didn't think that he really smelled it too strong and it was that much of a big deal. I just thought he was, being dramatic. The same was with sounds. So again, I didn't know. I just noticed things were changing with him. And the same happened with some of my patients that came in for sinus issues. And then I noticed that they had tics, vocal tics, and I noticed that it wasn't something they were doing on purpose. Or kids that were too touchy and they knew they were like, my brain is not listening to me. And we were working under constipation, but might as well. We started addressing those issues, and then I started learning that there are sensory issues that are not really under kind of our control, and I'll explain. Okay, so I want to talk to you about what is sensory processing disorder, kind of how to diagnose it, what causes it, treatments that are out there, and further recommendations that you can implement at home. So if I need to explain SPD to a child, what I would say is our brain is kind of like a computer. And like any computer, sometimes it has little mistakes. So it could be that everyone else around me, when we go to the cinema, they hear it on level 8. But my computer processes it as, whoa, very, very loud. And that's why it really hurts my ears. It could be that I smell too loud, or I need a lot of hugs, because when I get the hugs, when I get the input, my computer, it processes it as not enough. So I need it more than others. So it's about processing. And for you guys, I can say that SPD is a neurological disorder affecting the different senses. Now, how many senses do you guys think we have? You can write it in the chat or you can say it out loud. How many senses do you guys know? Okay, so the basic 5 are sight, hearing, smell, taste, and touch. But we actually have proprioception, which is the sense of our body in space. So it's do I know how much force I need to put on when I'm writing? If I'm putting too much force, it's something about how I perceive my muscles, my body. Also, we have the vestibular system, which is more of a balance issue. So if I get too dizzy, or if I can spin and spin and spin and I don't get dizzy, again, it's about processing, and it's the vestibular system. And there's the 8th sense, which is interoception. And I'll talk about it in a second. So with tactile, we see that some kids touch more than others, while for others they can't tolerate touch, or about the clothes we're wearing, about if something is too hot or too cold. With auditory, we see those kiddos, or even grown-ups, that can't tolerate going to a restaurant when they're singing happy birthday or clapping, or they hear it very, very loud, and then it causes a lot of stress. With interoception, it's when I'm always hungry. It's what's going on in my body. Am I perceiving what's going on in my body the way it is? I'm eating and eating, but I'm not getting the signal that I'm actually not hungry anymore. And it could be the other way around. Some picky eaters can be a lot of things, but one of the things is my body is hungry, but my computer is not receiving the signal. It's not processing it right, so I just don't feel like eating. So once you kind of balance that, then they know when they're hungry or when they're full. So that's another thing. It's also kids that they don't need to go potty. You ask them, we're leaving, we need to, let's go to the toilet, and no, I don't need to go. But then it's from 0 to 100 like that. They need to go right now. So that's another thing about interoception. Official diagnosis. The thing is, we don't have one. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, it does not include SPD. Pediatricians are not trained to diagnose it, and often they will automatically rule it out because, like for ADHD, there is a requirement where it has to be present in 2 or more settings. So it has to happen like in the school setting, but also at home. And often what you'd see is a child that when they go to school, there's so much stimulation, it's too much for them, and then they go from 0 to 100 and they'll explode, or it's hard for them to sit down. It's a lot of stimulation, but at home, they're very comfortable, everything is mellow, and you don't see it at home. But it could be the opposite. Some kiddos at school, they know they need to behave, so they hold it together. They put a lot of effort in keeping it together. But then when they get home, and after so much stimulation and bottling it up inside, and then they just lose it at home, and parents will say, we're walking on eggshells, we don't know what's going to trigger, and it triggers. So it doesn't happen, and it doesn't necessarily happen in more than one setting, and then they automatically rule it out. Some comorbidity is when you have more than one thing present at once. So like with children that have autistic spectrum disorder, most of the time they will have sensory issues, but not everyone with sensory issues is on the spectrum. So it's a comorbidity. Another comorbidity could be ADHD, could be anxiety. So you might have all 3 of them, or you might have 1 of them or 2 of them, but not necessarily all together. Does anyone know about misophonia?
No.
No. So misophonia is when you suddenly have, someone says yes. You suddenly can't tolerate specific sounds. And it's not with SPD. When you have a problem with auditory, it usually starts at a very young age. You can see that they can't stand loud noises. It could be clapping, it could be singing, it could be the vacuum cleaner. Misophonia could be at any age. It could, with teenagers, one day they cannot tolerate a specific sound, and it's not loud sounds, it's specific sounds. So it could be even just chewing. And I've seen a few cases where the child could not tolerate to sit and have dinner with their family, because especially one person in the family that chews louder than others, and it wasn't there before. Something triggered it. So it's a different kind of onset, and it's different because, again, it's not loud sounds, it's specific sounds, and it's not a sensory issue. It's something different. It's called misophonia. Anyone encountered pandas? So PANDAS is also a sudden onset where there's anxiety and behavior issues, and it wasn't there before. Parents would say, one day my child totally changed, and that is following a staph infection. And sometimes parents weren't aware that the child had an infection. So there was no fever or any other sign, but antibiotics is actually what helps with that. Okay, so the pathophysiology of SPD, things that could cause it, the why. It could be following a virus. Like there are those, what do you call it, parasites that encounter rats. And it kind of plays with some hormones in the brain. So a cat comes, and the hormone that's supposed to say danger, danger is saying danger, danger, but their computer processes it differently. So it's like, oh, I want to play with that guy, and they go play with them, and that's how the cats eat them, and then that specific parasite transfers to the cats. So sometimes I see changes that occur after a virus, a simple virus, and it kind of, again, plays with the buttons, and it's reversible. It could be following a traumatic birth. Sometimes you don't even think it was traumatic. It was just a very, very, very quick delivery. And again, it triggered some of the hormones or some areas of the brain. Sometimes with medication. And at first cases I saw, it was after like mood medication, but also it could be just from antibiotics in pregnancy. Sometimes that's enough to trigger it, because there is a genetic factor. So there was the potential, and then there was something that triggered it. But again, the good thing is it's reversible. Could be emotions during pregnancy. If it was something very extreme, a lot of stress, different situations. Even though there was a mom that she told me her pregnancy, she was very, very young. She was a student. She was under a lot of stress with her school, and she was not at all expecting a child. And that was enough to trigger some mild sensory issues, which, again, reversible. So we're not too worried about that. There was a breakthrough study in UCSF that revealed that there's a biological basis for sensory processing disorder in kids. So they actually can see it in the white matter in the brain. And that was good news for a lot of parents, because when there is no diagnosis and there is no recognition from, the school and friends, and everyone is just blaming the parents for, why is your kid behaving like that? So once there is more of a, you can see that there's a reason for it, and you're not making it up, and your child is not making it up. It's okay. There is something about it. It's real, and we can get support, and that's very, very helpful. So different treatments. Most of you probably know occupational therapy, and occupational therapy is based on the neuroplasticity of the brain. So the brain's ability to be flexible and fix some of those errors. And they work on most of the senses, not on the emotional imbalance. The emotional imbalance is, I'm thinking about the easiest way to convey it to you. So say sometimes women, we get like rage when we're menstruating or something, or very, very sad, and we don't know why. It's like, why am I feeling this way? And then, oh, okay, I just got my period or something. It's like something was not balanced. And it can happen when we're too tired, or again, from hormonal issues, but it's not on a daily basis. It comes and goes. So when a stress hormone is too loud, that means I'm feeling something. And again, stress hormones are normal. It could be when I'm hungry, when I'm tired, or something stressful happened. And when it's too loud, the body's overreacting. So you can see it with small babies when they have colic, because it's normal for babies to have a little bit of gas, but when the little gas is triggering a lot of stress, for some babies it's colic. It's so much pain. For others, it's reflux. They will spit out. It's the body overreacting to the stress hormones. Eczema is the same. It's the body overreacting to something, either to food or to stress, and it's just it manifests on the skin. So with sensory issues, sometimes you see it in behavior, right? It's too loud, but then I'm overreacting to that because that's how I'm processing it. I'm feeling it too much. And some kids will say, I don't know why I get so mad. I don't want to get so mad, but I do, and I don't know why. It's not that they choose to. Behavior-wise, they know they're working really, really hard to control themselves, but their system is experiencing it as, again, the stress button is pressed on too loud. With therapy, when they go and talk, or it's a drama therapy or art therapy, it's working on the neuroplasticity of the brain, and their focus is on the emotional issues. What I do is I call it sensory balancing, and I use tools from Chinese medicine and from NAT, allergy elimination, different tools and techniques. And it's the same. It's the neuroplasticity of the brain, believing that the brain can fix some of the errors. And it's more the emotional imbalance, the stress hormones being too loud. There are other senses, but for vestibular issues, I really, really recommend occupational therapy. They do an amazing job with that. And what you want to do is incorporate a sensory diet, not a food diet. A sensory diet is tailoring for each child's needs and their daily struggles, tailoring physical activities and sensory toys that are specific for their needs. Could be, but does anyone know what a body sock is?
Nope.
Body sock is one of my favorites. It's this. It's like this flexible, like how do you call it? Sleep sack, but it's not a sleep sack. You just go in it, and it's very flexible. So you kind of stretch your arms, stretch your legs, and it helps decompress. It helps kind of one of my favorites. You can go online and look up body sock, and that's a lot of kids. They that's their go-to. They go home, they just go inside of that, or they need to sit and listen and be focused, and they go inside that, and that helps them de-stress. Again, there's no one size fits all, but it's something you want to look up and see if it's relevant. It could be a jump toy. It could be a tunnel that you go inside. It could be something like that. It helps you kind of forget what you're doing and just focus on this for a second. Like, just it takes a little break. And sometimes I give kids 2 different colors at once, and then I tell them, okay, let's hold a race between those 2. Or something like this. Again, takes off your focus for a second. You look at something else. Kind of a brain break. Or this new little gadget, fidgeting toys or stress balls. Just try. It's a lot of trial and error to figure out what is right for each kid. For some, balance toys or the balance swings. Other recommendations, daily massage. That could be a really, really make a big difference. Like sometimes I show parents that you start and the child is fidgeting, they won't, they like quiet, but the more you do it, the more they learn to relax. And when you relax your body, it teaches your brain to relax. But it takes time. It takes like, okay, let's do it for a few seconds. Okay, let's do it again. Tomorrow again. And again, you teach them to de-stress. Big issue. Some of the massage techniques are good for specific senses, but just getting the massage is very relaxing. Exercises like Qigong exercises, breathing, working specific acupressure points or specific meridians, again, to whatever needs. Again, we're tailoring it to your child's needs. Specific pressure points, like if the child knows that something triggers their anxiety and it's too much, then learning a few, we call them buttons, that help them de-stress. Or sometimes children need to detach themselves from a situation. I had this kid, we worked on her auditory issues and her anxiety, and then she said there was one point that was left that was really troubling her. Whenever there was a fire drill, she was very anxious. So I said, okay, you want to detach from the situation. Next time it happens, you don't focus on how you're feeling. You focus on telling, coming home and telling your parents what happened. Like at the same minute, you think about, oh, okay, I'm going to tell them, okay, the teacher did this, my friend did that. Just look at the facts and already play in your head what it's going to be like later. And we added a button for that, which was the fast forward button. So little techniques that help daily activities that are difficult. For some, Epsom salt bath would make a difference. Like it will help with the sleep. Sometimes it helps with the constipation too. Physical activities could be martial arts, could be soccer, sometimes swimming, because for some the water is again helps them kind of ground. Biofeedback is something that I use very often, and I recommend it for families. I use the one that you attach the sensor to your ear, and it shows you on the screen what's going on inside. If you're coherent, if everything is calm, or is it kind of up and down, and it shows you what, because the kids actually call it a lie detector, because you talk to them and then you talk, everything is fine, and then when they talk about their friends, then it starts being incoherent, and then they can see that this is what they're stressed about. It could be that they have a problem with sleep, and then we talk about sleep, and then it shows them. And the good thing is, it's like training a muscle. It's like the stress muscle. You teach yourself, okay, so whenever it shows me that I'm stressed, I'll see what works, because for some, breathing will help. For some, it will make it worse. So some need to focus on something physical, like I'll show you a short exercise. I'll just put this down for a second. If you put your fingers together like this, but not your thumbs, and then you let go of everything, so you're no longer holding your thumbs apart. What happens is they start coming together. And usually when the thumbs come together, that means I kind of let go of everything, and that will change what's going on. You'll see on the screen of the biofeedback, oh, now it's green. But again, not for everyone. For some, I'll tell them kind of, and this is something you can do with your kids too, you can kind of hold tight and let go. And then hold tight all the way to your elbows and let go. And all the way to your shoulders and let go. And all the way to your belly and let go. And then you add your hair and your face, and then you make a funny face. And you'll see that will help them de-stress. But for some, it's when they focus on a pancake, and I ask them, what are you going to put in the pancake? And when they focus on the toppings, that's when they de-stress. And again, the thing is, with sensory issues, and especially, of course, with emotional processing, the thing that I see in common is something always triggers at least one stress hormone, and that stress hormone is too loud. So in any case, we always want to work also on stress and having it tuned to what we all feel. Because when they are being dramatic, it's because that's what they actually feel. Nutrition-wise, I would avoid suspects like casein, gluten. For some, it will make a big difference because, again, we have an issue with stress hormones. If they're sensitive to casein or gluten, again, it triggers the stress hormone. So the body has something is bothering the body all the time when they eat that. It's another something bothering their computer. Refined sugar, even if they're not sensitive, something good to avoid. Some do great with ketogenic diet. Some it won't make a big difference. Ashwagandha, or there are a lot of herbs that could be beneficial. Sometimes magnesium makes a big difference. Sometimes B vitamins help with the stress. So it could be different things. Ashwagandha is an herb I really like because it's adaptogenic. It knows where the stress is in the nervous system, and it goes there. So it's very smart herb, and in many cases it's helpful. But like everything else, there is no one size fits all. It could be one of the things that will be beneficial. And there are other herbs and supplements. Again, Qigong recommendations to do together with the child and give them more tools that they can help to, for grounding, for getting the stress out of my body, out of my head. It's a very big deal. Feedback, herbs and supplements. And the most important thing is it's a quote from Glenn and Milton. Don't let yourself become so concerned about raising a good kid that you forget you already have one. So that concludes the part of what I want to say to you. And now I'm going to open it for your questions.
Hi, I wrote a question in the chat. I'm not sure you saw it, about neurofeedback machines, which you would recommend.
So I use a Biofeedback. Mine is from HeartMath. I bought one that is on a computer and it has games, so kids could play with it. So it's not just showing you lights; it's actually games. But it's more expensive. It's for practitioners, and when I do online sessions, I tell parents just buy whatever. You don't need to buy something advanced. Just a simple thing that shows you if it's red, which is stress, green, which is or blue, which is in the middle, because all you need is to practice your stress muscle. For some teenagers, I tell them, some of them don't want it on their ear because if they have online Zoom classes or something, they don't want the teacher or other kids to see something on their ear. So I tell them just buy the finger sensor. And what I tell them is, so if you're stressed from class, you see it on the screen and then you learn what helps. And I had this teenager, she had a few issues, and one of them was abdominal pains. And she told me that in the past she cut down on gluten and dairy, but she went back to eating them because it didn't help. And when I checked her, I said, okay, you are sensitive to gluten and dairy, but the reason it didn't help is because it's not just that. It's reacting to stress hormones. So foods that you're sensitive to are triggering those stress hormones, but stress is also triggering that. So we did a lot of biofeedback. And then, like she would say, today my pain level is between 3 and 7. And I didn't show her the screen, but we were talking. And then I'd say, oh, now it's a 7, right? And she said, yes. How did you know? And I said, because it's red. And when it was green, I said, now it's 3. And she said, yes. So she learned that this helps her control her pain. And then she would say that she would do it to herself. Whenever there was pain, she knew that means she's stressed. And she started thinking, what am I stressed about? And using techniques that we saw together that were helpful. And again, there is no technique that works for all. You can do breathing as much as you want, but if breathing doesn't help you calm down, that's not the right technique for you. So it's practicing the stress muscle, what makes me stressed, and how do I control the stress.
Thank you.
My pleasure. Any other questions?
Hi, Neta. Julie is asking, what is your experience with neurofeedback?
With
Neurofeedback.
I do not use neurofeedback. I use biofeedback, which shows me the heart, if it's coherent or not. Coherent means everything is, it's flowing, and also even when it's flowing and very calm, you can see how calm it is. So calm could be 1, which is, just starting to be calm, and sometimes it's like 6. And then again, you see what makes you feel super calm and what kind of throws you off. And the more you practice, the more you are aware of your body feelings. Like you can tell, oh, when I feel this, I know I'm stressed, and I know I'm not gonna let it. Because imagine all day long, and many times it's the kiddos that don't show it. Like they're just, they're not talking much, they're very quiet, and you have no idea that as soon as you hook them up to the biofeedback, and you're like, whoa. So that's why they have those tics or vocal tics. Wow, I didn't even know that they're stressed, but their like normal level is stress. And it helps you understand, okay, I didn't even know, because that child didn't show. Like his sibling, she like has tantrums and she runs all over the place. So I know that she's not calm, but for him, you wouldn't even know. And so those tics, so could be herbs that will help, or massage, or some acupressure points that will do, but it helps you. It's really something I recommend for everyone, because even us, sometimes I would sit and work and not even know that I'm stressed, and then I learn to read signals in my body, and then I learn to tone it down. I don't want to be walking around and having this not even be aware of it. And neurofeedback, I think it's a different kind of testing. I think they use pads differently. I don't remember. I remember I read about it once, but then I focused on biofeedback. That's what I went to study, and the testing mechanism is different. Have you tried it, Julie? The neurofeedback? Okay. Does it sound close to what I'm describing? I see. There is no one thing that helps everyone. That's something I learned over the years. There are so many different methods, and there is never one size fits all. Everyone has a connection with something different, and that's what's going to help them. But if you want, Julie, you can contact me later, and I'll try to figure out what you did, and maybe there is potential for you using that.
Hi, Neta. It sounds like they can have the condition of SPD spontaneously by a virus or a birth story. And I wonder, can they grow out of this condition at some point spontaneously, or how does it work?
Many times they do outgrow some of it. But I see grown-ups that have those issues for years, and again, they learn to control some of them, or just let them be. But there is some emotional toll, like a little bit of sometimes shame or guilt, because again, I remember years ago, was like, wow, maybe 15 years ago, a friend called me And she was so excited. She said, I just read that there is something called highly sensitive person. I'm not the only one. Because she was used to always being addressed as, she's the drama queen. She's always so dramatic. And she didn't know why. And she knew that everyone was talking about her as being the drama queen. And suddenly she read that there's a highly sensitive person. It's a thing. And it's not that something she made up. It's not her fault. And she's not alone. So the more awareness there is about this, the easier it gets. There's some therapies and there's acceptance, which is a huge deal, because I see parents that some of them are not even aware that that's what the child has. They come for themselves, or they come for another child, and then they complain about this child that gives them a hard time all the time. And when I listen, I say, no, it sounds like they're actually having difficulties. They're not doing it on purpose. This is their reality. This is how their computer processes things. That's what they deal with. So those kids that grew up and no one knew what they had to kind of work through it and not show, and just go to the cinema and stick it up, or put some earplugs, or they just had to deal with it because no one knew what it was. There wasn't a lot of acceptance around it, and they had to adapt. But some of the things, people tell me that they did outgrow some of it. Do we have a highly sensitive person with us that wants to talk about it? I will not forget how she was so happy just to learn that there is such a thing. And I also had an acupuncture patient once tell me that she had a previous acupuncturist, and she tried to tell them that she's sensitive. She can tolerate up to 4 needles. And they didn't understand that what she was saying, it was real. She really could not tolerate more than that. And they put more, and she had a strong reaction, and she never returned. She took it really hard because she said that they didn't listen to me. It's I know my body. I cannot tolerate more than that. And again, the more there's awareness about this, the more the teacher knows and is aware that the child really needs more breaks, more sensory toys, take them outside to do some laps and come back. The more they are aware of their struggles, the less stress they put on those kids. Even for grown-ups too, we know that we have a problem with some too much sensory stimulations, and we need a break. So it could be that we're working from home, but we put like small, not bike, but like pedals under the desk, and we do that, and then our brain that is racing and in stress, now the body is taking out some of the stress so we can focus better. So again, awareness is the key, because we can give more support, get more support, reduce stress. You're already making a big difference.
Neta, can you explain again the connection between SPD and autism?
There is a comorbidity, which means that most autistic kids suffer from sensory issues. They have a sensory overload. They might be too sensitive to sounds or to sights, or they're experiencing a lot of too much stimulation at once. But SPD does not mean that you have an autistic spectrum disorder. It could be that I'm just having a sensory issue. It could be just auditory. Could be just something about touch. I had this kid that he came in for constipation, but he was always very sad, because whenever he was stressed, and again, he didn't know to say it, but you can see that there's stress in his system, and his outlet is touching others, like hugging them. And he knew that it was causing him a price to pay, because kids would avoid him. They didn't like it. And he said, I know, it's like my brain is not listening to me. He was not doing it on purpose. He was very aware. Many times those kids are very, very aware to what's happening. They feel guilty. They feel ashamed. Most of them do not know how to express it. Some of them, wow, they can tell me exactly, like, I don't know why I got so mad, and I want to stop that. I want to control it. And this kid, once we worked on his stress hormone, he wouldn't touch kids. He would be calm. And I remember for a few months, Mom said he was very happy, he made friends. And then she called me, were on a trip, and she said, I don't know what to do. He's touching again. And I said, yes, on a daily basis, his stress level is fine. But when you take him out of his routine and he's on a trip, and it's even if it's good stress, it's the stress hormone is a little louder because you're on a trip. It's away from what he knows and more excitement. So his outlet is more touch. So maybe hug him more, massage him more, help him with the stress. But that's what it is. Once his stress levels go back to normal, he won't need that. That's his outlet.
Thank you.
Amanda, did you miss some of it? If you need to, you can contact me later, and I can give you a briefing. Okay. I see, Amanda. So yes, just you can schedule like a 15-minute consult with me, and I'll give you some ideas. Because like I said before, there is no one size fits all. We have to be creative, and I keep encountering new cases that you need to be very creative on how to approach it and how to help them. And that's what kids are all about, being creative and finding the ways that help them specifically. No worries. I'll fill you in. And yeah, if you have specific questions, you're all welcome to do like a consult, and I'll see if there's something that you can try specifically. SPD pediatricians. I don't know how many of them are, but many times it's skipped. Or even teachers, it's something that it's actually a lecture I want to give to teachers, because many times they don't know that the child is humming, not because they're trying to disrupt the class. It's because when the stress hormone is too loud for them, that's one of the outlets. And again, because the sensory input is so much, then it triggers the stress hormone. Some kids, they do homeschooling just because of too many tics. Like there was this kid with 27 different muscular tics. No, that was including vocal tics as well. But so much stress in the system, and the system does not know how to deal with it, and it's tics. So yes, I feel that not enough educational staff know, or not enough pediatricians. And again, recognition is a huge thing, because once you know, the child can get this first, just learning that what they have is not their fault. It's not that you take away the responsibility and say, oh, it's your brain, it's not you. It's showing them that yes, you're doing a great job, you're working really, really hard to control it, and yes, this is a little too loud, we need to work on it, and we'll help you. That's yes, I see the noises. Yes, it's probably a tic, and the tics are again it could be stress when I'm feeling stressed. But stress could also be that my body is stressed, like pain or being too tired or hungry, and it's triggering a stress hormone without me processing that I'm stressed. It's not an emotion. It's a body awareness. IEP, not in all cases, they don't always need it. Sometimes they just need the teacher to know that, yes, they need their stress ball or their fidget toy, or to have like a board to help them when not have so many distractions. So if they want, they can open the board and they get a little more privacy. Or if they need some gentle earplugs so they don't hear the noises too loud. So I think if once you recognize the needs, I would talk to the teacher or whoever is in charge and make sure they have some accommodations. Again, not everything will require an IEP, but at least bring awareness. Like for some kids, they will when they need to, they will go and run the track, and there's someone who escorts them. They come back, and now they can focus. Or I would give them, again, you have to make sure that the teacher knows and knows it, but lots of gadgets that help them focus better or get rid of the stress. So I will work out with the kid to see what your child needs, what they like, what helps them, and then make sure that the teacher is aware and helps accommodate. Did I miss any questions in the chat?
I think you've answered them all. Someone asked at first if you can, let me see, if you can point to some studies that back these links.
Which ones? Yes, I did. I did use studies when I did my presentations.
Okay, so we can send them those links later.
Yes, can SPD. Yes, that's one of the comorbidities. It could go together, SPD and ADHD, but you can have just ADHD or have just SPD. It doesn't mean they always go together. It could be, again, a comorbidity with anxiety, but it doesn't have to be. It could be someone just having anxiety, and it could be together, like specific sensory input can cause anxiety. With Joanne is to work with
other than occupational therapist. I'm sorry.
Okay. So occupational therapy is good. What I do is address it differently, but I don't work on vestibular. If it's more the emotional, then could be drama therapy, art therapy. Again, all those techniques work on the plasticity of the brain, neuroplasticity. So it depends what is the main issue.
Okay.
Drama therapy. So pediatric therapists, it could be some work with art, because with little kids, they don't always like to talk the whole session. So it could be through drama and play. It could be through drawings and artwork they do. I think even family marriage therapists, some of them also will incorporate different games and toys and some acting. So you want to find out what their tools are, and some call it drama. I think it's called drama therapy or something like that. That they, through acting out and playing, they will address what's going on.
I have a question. I'm sorry I'm late. Can
No
you hear me?
worries. Yes.
Sometimes my son has kind of like outbursts, like he wants what his sister, he has a 5-year-old sister and he's 7. And sometimes he gets very upset when she has something like different than him, or, you know, and I try to explain to him that, you don't always have to have the same thing, you know. How do you deal with a situation when he kind of gets really upset about something like that? And, you know, kind of, I don't want to say jealous, but it does, you know, kind of seem like he wants to have everything, you know, and learn how to share a little bit, or I don't know. Yeah.
Is
It just is difficult.
Is the problem, does he get like not unproportionally upset, or just why he gets upset?
He's getting better at it, but he kind of folds his arm and, you know, pouts his lip, pouts out, and, you know, he used to have outbursts, you know, like, yeah, I want this, you know, but he's getting better at, you know, regulating. But I don't know, he just really feels like he's left out, like, you know, what about me kind of thing. And I'm just like, where is this coming from?
Okay, that's what you want to have him answer. So you take him for a special time for something, and
yeah, we have special time.
And you talk about things, and then you ask him, and you find out where that's coming from. Where does he feel that he's not getting enough? But the more you will share things, he will mimic you. He will see, oh, okay, it's kind of a skill.
Right.
Because the more they learn to say it, they don't need to.
Right. Knocked out.
Yes.
Like use the words, you know, because I've gotten a lot of strategies from his teacher about, you know, taking his anger out on little toys and, you know, little items that he can use to kind of get that anger out, little balls. But I'm just like, I don't know, like we spend alone time together with just him, but I feel like it's his younger sister. He feels like she's gonna, you know, replace him. And I'm like, no, I love both of you all just the same, you know, but I don't know. It's a lot of competition between them.
I would share with him places where you felt maybe left out, and how you dealt with it, and like teach him. Yeah, because they're great mimickers.
Okay, I'll try that. Thank you.
My pleasure.
I have a question. This is Sarah. My question is where I would start with. My daughter seems to fall into the like highly sensitive category. She's just has very intense outbursts about a lot of things. The main trigger for her now seems to be bath time or shower time, and specifically washing her hair. So would that be starting with, and it's more than, it just seems like to the point where like she bit my husband's arm the other day to the point of like drawing blood. So like I have an appointment with the pediatrician, but are there any other, is that like something I could take to occupational therapy, or like where do I start for that?
You could do occupational therapy, but also are there other areas where she's acting out as much?
Yeah, it seems to be when you were talking about, you know, she is in day camp this summer and she does great. 0 behavior issues. She's fine getting her hair wet in the pool, really keeps it together all day. And then everything, when you said this, I was like, this is us. Like we're walking on eggshells at home because just any little trigger, if things are moved out of place a little bit, it's an outburst. If we don't, it seems to go beyond the normal pickiness of like, oh, I wanted grapes instead of carrot. It's just like everything is a fit.
Yeah. So stress reduction, work on having her stress levels lower. So you can schedule a consult with me. We'll think about it, or the biofeedback, or do a lot of massage for her, or anything that if you want to do a pediatric acupuncturist near you, it's anything that will help her computer tune the stress button lower. And once it's lower, that's when you can start talking to her about it. Like teach her to use her words. Because there was, last time I saw a kid like that, it took us like 5 times until, and I told Mom, you know, for five times, I'll give you homework, what to do. And after we reduce it, you start teaching him how to say it, because the 5th time, that's when I saw the first outburst. And when I saw that, and then I told him, okay, what do you want? Just tell us, maybe you'll get it.
Yeah.
And then he said, I want the phone. I don't want my brother to have the phone. I want the phone. And I said, okay, tell it to your mom. Maybe you can get that. And he told her, and she was like, oh, it's the first time that he actually said something. And I said, okay, now that he's able to, now you start every time you see something, you say, okay, use your words now. And she said, okay. Now he started telling us when he's really mad at us, and it's new.
Yeah.
So 2 things. One, you need to teach her to use her words, but you have to also understand that she is actually, the stress levels are going from 0 to, and you need to help her reduce that first.
Okay. Thank you so much.
My pleasure.
Can I ask? Yes. Hi, this is Amanda. I have a question. How can I connect with my 5-year-old to help her to come to a calm place? Because she just gets so angry, and I can't connect. She screams bloody murder. You could probably hear her pounding on the door now.
And what
can I do?
When she's not upset, how do you connect with her?
We play together. We used to do some arts and craft, but that's kind of stopped because we had to move, and we're just trying to get settled now. But she has been like this since 3 years old, and she's 5, about to be 5.
Okay.
And I don't. She's in occupational therapy, but it's not. I don't know if it's really working. I've been trying to get into parent-child interaction therapy, but it's so far out trying to book it, and I don't know what to do. I'm lost.
Okay, no, I hear you. I feel like massage techniques would be really good. There is one technique that I do, like with my kids. When one of them would be in a tantrum, I would hold them, and if you contact me, I'll send you a video of what I do. And I would do something that was very grounding. And while they were kicking and screaming, and at some point they're like, okay, something's going on, and they relax. And then the next time I do it to them, or the next time, it took less time for them to stop kicking and crying, because they already know in their mind that, oh, this is gonna relax me. So and then it's to a point where one of them is crying, and then the other one would say, Mom, do this to them. And then you find the techniques that help. You practice them when they're calm, so they know what it is. And then it's, again, the first time it's like more kicking, screaming, but you find the ones that help ground. Make
Can
sense?
I jump in? This I put in the chat. Also have my son's teacher said chewing gum helps, and it actually works. Like every time he puts the gum in his mouth, like it helps calm him down. I don't know what it is. It works wonders, the chewing gum. And then the other point I wanted to say for the parents, it's a 3 P's: pass, praise, or play. So you have 3 options to help calm yourself. Either it's something that you don't want to deal with right now, you're like, pass, it's just like something that you can't deal with right now. So it's like, okay, I'm not going to feed into that behavior. Don't give it any attention. That's the pass. And then praise is when they're obviously doing something good. And then play is one way. I think you talked about it earlier about, connecting with them through play and everything. So pass, praise, and play. Those are 3 techniques that you have in your armor to choose from, depending on the situation, right? So pass, I'm not going to deal with it right now. I need time to cool down. Praise, or play. So that's what I always keep in my mind.
Sounds good.
I've learned a lot. Gotten better.
Okay, I think, Hadar, is it gonna disconnect us?
No.